Thank you. Just reminding everybody that we are recording this meeting so that we can go back to it to reference in the future if necessary. My name is Rosalind Huey, Deputy City Manager, and we're gonna handle just a few housekeeping items before we get into the agenda tonight. And I'm gonna ask Carlos to provide instructions for interpretation in both Spanish and Vietnamese.
Yes, saludos everyone. Happy New Year. This is Carlos Velasquez, part of the city's recovery task force team. I wanted to just share some housekeeping notes. This meeting will include interpretation in Spanish and Vietnamese. Gracias and welcome to our interpreters for today, Armando, Tiffany, and Priscilla. To access the interpretation in Spanish and Vietnamese, click on the interpretation button on your Zoom screen and then select the appropriate language. In addition, the interpretation for all of you is set to off. We recommend that you click on the interpretation, which is on the bottom kind of tabs of your Zoom screen, and go to the English channel so you can hear all of the interpretations in English. We have two videos, one in Spanish and another in Vietnamese that will play right now.
Hola y bienvenidos a esta reunión. Para acceder a la función de interpretación, haga clic en el icono del globo en la parte inferior de la ventana de Zoom y selecciona el idioma que desea. Para escuchar claramente el audio de interpretación, le recomendamos que también seleccione la opción para silenciar el audio original, que es la opción más baja en el menú después de hacer clic en el icono del globo.
Xin chào và cảm ơn quý vị đã tham dự buổi họp ngày hôm nay. Để truy cập vào phần thông dịch của ứng dụng Zoom, xin nhấn vào biểu tượng hình quả địa cầu ở phía dưới của màn hình và chọn ngôn ngữ theo ý muốn của quý vị. Để nghe rõ lời phiên dịch, chúng tôi khuyến khích quý vị chọn chức năng tắt âm thanh gốc nằm ở phía cuối trong phần tùy chọn của biểu tượng quả địa cầu.
Awesome. Again, welcome everybody, task force members. We ask all of you to rename yourselves on Zoom by your first and last name, and also to add your organization name, just so we can ensure that you're identified as a task force member. All you have to do is find your image and click on the top right of the image. There's those little three dots. Just click on that and then just go to the rename option and rename yourself. This meeting is open to the public. Saludos to everybody. Thank you so much for being here. You'll be able to see and hear tonight's meeting, and you will have the opportunity for 2 minutes time to share your voice and comments in your preferred language during the public comment portion of the meeting. This will happen towards the end of the meeting, towards the end of the agenda. So until then, we appreciate your patience during the rest of the meeting. And for task force members, there will be time after each section of the agenda for questions and comments. And we ask that task force members, if you do have a question during that time, to just use the raise your hand feature found below on your Zoom screen. And either myself or Rosen will be the one announcing you so you can unmute yourself. I believe that's all the housekeeping. Back to you, Rosalind.
Great, thank you so much, Carlos. I do see a hand raised, and I'm just wondering if it's a clarifying question or someone is having issues with Zoom. Want to acknowledge before we move on. Yes, caller ending in 8007.
Hi, this is Christine Fitzgerald. I'm one of the task force members calling in on my phone.
Great. I see, Christine, I see that I have the option to rename you. Is that okay if I just rename that number to your name?
That is fine, and my organization is the Silicon Valley Independent Living Center. Thank you.
Great, thank you so much. All right, well, before we get into the agenda, I do just want to state that just really want to start our meetings, and we've been doing this, acknowledging that we are on the ancestral lands of the Ohlone people. And we pay respect to their elders, past and present, and we give thanks to their sacrifice and examples of humility, stewardship, and resilience. And so with that, I think we're just going to go quickly into a review of the agenda. And before I do that, just really want to welcome everybody back into the new year. We really hope that you had a lovely holiday season, and then that you and your family and friends are now staying safe as we're learning how to navigate COVID-19 and this new variant. So we hope everyone is doing well. I also want to acknowledge that the city manager's office has a new team member, and we couldn't be so more delighted than to officially welcome Rob Lloyd, who was just recently appointed as Deputy City Manager. And so Rob and I are going to co-share this work with you on recovery. And so Rob, I'll give you a few moments just to introduce yourself, say hello to everybody.
Thank you, Rosalind, and to the team. So I got to attend last month's meeting and just so deeply impressed by the commitment from everyone. So I'm happy to support the work. Truly believe there's nothing more important than what we're doing right now, because the things that we do these few months and years are going to shape the next 10 to 15 and can really make a mark on the community. So I'm really happy to be supportive of you and glad to get to know you more over the coming days and months and weeks.
Great. Thank you so much. And we're super excited to have you join us, Rob, and all of your experiences that you will be able to bring, and all of your expertise to help us along the way. So with that, we're just going to do a quick review of our agenda this evening. So we thought it would be a good idea actually to start off with just a very brief update on COVID-19 in general. So we have a member of our Office of Emergency Management with us, Alvin Galang. He actually serves as Director of the Vaccination Task Force for the city. So he's going to give us an update, a very general update on COVID-19. And then really the main focus of our time this evening is going to be around the ideas for task force committees. And so we'll just go right into that. We'll present all of the ideas that we received. We have the idea of actually breaking out into groups to further our discussion. And then after that, we'll end the meeting with public comment and talk a little bit about next steps. So next slide. So now I am going to turn it over to Alvin to provide us with a brief update on how things are going out there.
Great, thank you, Rosalind. If we could get the next slide, please. Good evening, everyone. My name is Alvin Glang. I am the City of San Jose's Vaccination Task Force Director, and I will be providing you with the latest and greatest information on COVID-19. Now, the statistics that are currently on the slide, this is from January 10th, but I do have updates that I will be presenting as of today. So the first bullet point there, the Santa Clara County case rate is currently 4,231 per 100,000. So yes, in a span of 3 days, it did increase. As far as the deaths in Santa Clara County, unfortunately, we do have 1,951 deaths from COVID. However, the 0.1 per 100,000 7-day average has remained fairly steady. And so we are currently experiencing, even though we have a lot of cases happening right now, as far as deaths and hospitalizations, those are holding steady. We are still keeping a close eye on it. We're continuing to monitor, but the deaths and hospitalizations have remained fairly low and steady. Hospitalizations in Santa Clara County, as of today, there are 297.1 per 100,000. So again, a little increase from 3 days ago. As far as vaccinations are concerned, the number of Santa Clara County residents that have completed vaccinations, that number, 82.4%, has increased by 0.3%, and it is currently 82.7%. of Santa Clara County residents among all ages have completed their vaccination. So really that's roughly 4 out of 5 people in the county are vaccinated. With booster doses, that number has increased also a little bit from 3 days ago. 3 days ago it was 59.6%. As of today, it is 59.7%. So again, the booster doses are increasing, albeit slightly and little by little, but we're working our way up there. As Rosalind mentioned, the Omicron variant, that is responsible for the spike in cases right now. Also the timing of holidays, the cold weather, right? That's also responsible for the spike in cases. They're finding that the Omicron variant seems to be more transmissible. However, it also seems to cause less severe symptoms. And so even though, again, the cases are spiking, the symptoms seem to present less severe than the Delta variant. And so with that, it is still important to be complete with their vaccinations. Being complete meaning getting the 2-dose regimen from Pfizer or Moderna, or the 1 dose from Johnson & Johnson, and also being up to date, which means getting your booster on, up to date on vaccinations means getting your booster. Also important to continue wearing your mask, your face coverings, and of course to stay as healthy as possible. So again, all in all, we are doing, I think, much better than the country, much better actually than globally. Like I said, the case rates are going up, but it's also important to keep in mind the hospitalizations are remaining steady. And so hopefully we will get through this current spike in the next week and next several weeks. Like I mentioned, we're continuing to monitor, but for now, please continue to stay safe, continue to stay healthy. And that's all I have in the report.
Great. Thank you so much, Alvin, for sharing this information. Really, really important. We thought it was good just to share the latest data with our task force members. So thank you again. Are there any quick clarifying questions from any of our members before we move on? Rosalie?
Yes, thank you. I just have a question. If you could clarify, please, what this moving rate of 7-day average is. It says it's a 7-day average. Is that a moving day? And what exactly does it mean per day?
Yeah, so roughly every 7 days. That's exactly, it's a moving average, yes.
It's a moving average. So
Yes.
does it mean over a 7-day period, that's the daily rate, or that's the rate for a 7-day period and a moving average?
That's the rate for the 7-day period. So the daily rate may, and I think on one of the charts, like one day there were, I believe, 6,000 cases. But again, within that week, the average was, I think, 3,000 something or other. So it is that moving average.
Okay, thank you.
Yes.
I see Ben, your hand up.
Yeah, thank you. Just a quick clarifying question on the booster doses. Is that percentage based off of total population or booster eligible population? Do you know?
That is a booster eligible population. That's a great question.
All right, thank you.
Yes.
Okay, great. And I'm just searching my screen. I don't.
I see Luis Arguello.
Oh, thank you.
Go ahead, you're muted, Luis.
Yes, in our membership, along with the county, we also provide a booster, and at least 30% of our membership got a booster. When is gonna be the next booster, or how often, how frequently we're gonna have to bring another shot?
And that's a great question. I know this is not the ideal answer, but we don't know yet. We're not quite sure. I know that there's studies being done, there's talks being had, discussions being had about, are we doing this every 6 months? Are we doing it every 5 months? Unfortunately, we don't have a clear set picture yet. But we are continuing to monitor. And if we do get more information about how often we need that booster, we will be sure to pass this on to the task force members.
Thank you.
Rosalie, did you have another question?
Oh, not a question, but just a follow-up. So it was just announced today, if folks hadn't seen it already, that Pfizer announced that they have a booster that's specifically for the Omicron variant, and it'll be out in a couple of months.
Thank you for sharing. All right, well, Alvin, again, thank you so much. And to our task force members, just to let you know that, the city is providing, trying to use all the channels that we can to keep the public informed. So we have a flash report that goes out every Wednesday each week. And Alvin, I believe that the next COVID-19 update to our city council is going to happen on January 25th, I believe. And so
That is correct, yes.
All right, so of course, that'll be another opportunity to get updated information. We know that our mayor and city council members are pushing information out to our communities. And so we hope that you will help us as well get information to our residents. So again, thanks so much, Alvin, appreciate it. Okay.
Alvin.
So next slide, I think this, yes. So the next portion of our meeting is really going to focus on the ideas for task force committee. So next slide. So we gave you an assignment at our last meeting in December, asking task force members to submit your ideas for potential committees and to provide like a statement of what the idea is and give a brief description. And we just ask that these ideas, of course, be based on our principles that we've all been working in, and really based on our focus areas or pillars of stabilizing and strengthening our families, our workers, and our small businesses. And also at the last meeting, city staff presented updates on the 6 recovery initiatives. And so we thought it would be very important to have these committees relate to the ongoing work that the city is already involved in. And so we received lots of ideas, which is great. So thank you for putting those ideas together. We received a total of 31 ideas from 19 different task force members. So next slide. So what we thought we would do for this evening to kind of guide our conversation and make it a little bit easier for you all to discuss these ideas, we actually decided to group them into 7 different categories. And Carlos is going to be walking us through those in just a moment. But we received several ideas around supporting our workers, small businesses, housing, community engagement, data and budgeting, community health and wellness, and arts and culture. And additionally, we also got some ideas that either didn't fit very neatly into one of these categories, or we've kind of staff felt like we just needed more information from the proposer. So we're going to be hearing actually later in the meeting from those task members who submitted those ideas, just so that we can get some clarity. And I should also mention that we received maybe 1 or 2, maybe 3 ideas that are very good ones, and that they're already part of a city department work plan. So these are kind of, pretty significant, either a policy initiative, a project, or another item in a city department's work plan. And we can discuss this this evening as well. But we think that perhaps it might be better for task force members who are interested to actually be a part of that already ongoing effort. So with that, Carlos, I think I'm going to turn it back over to you to walk us through each idea.
Great. Next slide, please. So we have 31 ideas that we're going to walk through here. The ideas have been organized under the 7 categories that Rosalind just mentioned. For interpretation and accessibility purposes, I'm going to be reading off the what's here on the slides. And after each of the ideas under one of the categories, we'll give the member or the members who submitted the ideas just a brief moment should they wish to clarify or add anything else. So we received 9 ideas that we received and we grouped under the supporting workers category. The 3 ideas on this slide were provided by Task Force member Quincy Phillips of Joint Venture Silicon Valley Building Back Better. And the first one is a topic, community-based business, efforts like worker co-ops, social entrepreneurship, food ecosystem like home cooks, community farms, commercial kitchens. These initiatives would be aimed directly at increasing economic mobility for our most vulnerable populations. The second idea he submitted is under the title Economic Mobility, Upskilling, Reskilling Effort. This would support workers stuck in low minimum wage jobs with programs and services to upskill, such as English as a second language, management, and other courses that provide wage increases. And the third on this slide is, topic under this slide is creating youth opportunity pipelines, creating job, career, and entrepreneurship opportunities for talented youth. This would long-term, this would pave the way for accessing various community benefit agreement opportunities that will surface over the next 10 to 20 years of San Jose and regional development. So, next slide. The other ideas under supporting workers on this slide were submitted by, I guess the number 4 was submitted by 3 task force members, Maria Noel Fernandez of Working Partnerships, David Binney of Santa Clara and San Benito Building and Trades Council, and Hector Moreno of UFCW Local 5. And that's a topic, Worker Health and Safety Solution Group. And this is to focus on how San Jose can promote workplace health, safety, and justice to help ensure a full and fair return to work for San Jose businesses and workers. Idea number 5 was submitted by Ben Roschke of Team San Jose, and the topic is hospitality industry and hospitality workers. These are solutions to help assist hospitality workers still impacted by the pandemic while looking at ways to help energize travel demand to San Jose. This would benefit workers and owners of hotels, restaurants, arts groups, and other businesses that benefit from travel and tourism. Idea number 6 was submitted by Dr. Anu Balakrishnan of the Indian Health Center, and this topic is healthcare workers. This would be providing COVID-19 incentive bonus or hazard pay, mental health resources, counseling or support, and helping look at additional resources to help healthcare staff families during this recovery period. And number 7, the topic for a committee idea was submitted by Ivan Perez of Goodwill of Silicon Valley. And this topic is supporting workers. This would be connecting businesses with community agencies, colleges, and universities, providing employment services to individuals experiencing barriers to finding employment, such as individuals with disabilities. Next slide. And the last 2 ideas under the supporting workers category that we grouped was one provided by Sarah McDermott of Unite Here, Local 19. And that would be something that she's mentioned in prior meetings, a solution group on just recovery for airport and hotel workers. And this one, final idea that we grouped under the supporting workers category would be helping consider job brigades for providing public services in the city, additional help to nonprofits as food banks, and providing healthy habits for Latino families. So Quincy, So I know that I mentioned a good number of people, but Ben, Dr. Balakrishnan, Yvonne Perez, Quincy, and are there any of you folks who want to add anything else or clarify on your ideas? If so, feel free to raise your hand. Luis?
Yes, thank you. Sarah McDermott had something come up and couldn't be here. So she wanted me to add on the solution group on just recovery for airport and hotel workers. These are some of the industries that have been the hardest and longest hit by the economic impacts of COVID. And the workers in those industries are predominantly Latino, AAPI, and Black workers, and whose communities have also been the longest and hardest hit by COVID. Those industries are slowly starting to recover, and we know that they can and we want them to recover, but there is a very large fear among the workforce that workers will not be part of that recovery, that people with 30, 40 years of experience in the industry may not get to go back to those jobs as those industries regrow. So this work group would be to look at that skilled incumbent workforce, many of whom have been out of work for 2 years, and figure out how do we support the industry and the workers and our city to recover and come back. And we did know that there's a lot of overlap here, I think, with the group that Ben Roshby proposed. So we perhaps would be open to combining the two. Finally, wanted to note that this is not a proposal for training or workforce development. Those are also important, but we see that as a very different question. And invite anyone who's interested in this topic to join in this group if it gets created. Thank you.
Thank you, Louise. I see Ben, you wanted to add a little bit more to your idea. Go ahead and unmute yourself.
All right, great. Thank you. And yeah, I think there is, as mentioned, hospitality industry definitely has been one of the most impacted industries by this pandemic, and it is ongoing. So in addition to supporting the workers most impacted by this, we won't truly have a full recovery until we are able to get our travel demand back up. We're currently somewhere, hovering somewhere between 50 to 60% of pre-pandemic levels. And pre-pandemic, it was about $1 billion that came into San Jose from overnight travel on an annual basis, not just going into hotels, but going throughout the community into small businesses, restaurants, art groups. So I think, the idea of a specific solution group looking at how we can help our workers that are still impacted by this, while looking at means to help increase the funds available to build that demand back up would be key in a speedy recovery. Thank you.
Thank you, Ben. Hector, I see you also wanted to add a little bit to your idea that you submitted. Go ahead and unmute yourself.
You said Hector, right?
Yes.
Okay. So for UFCW and the grocery workers and also the service workers, since this is not a pandemic anymore, this is more, we're going into more into an endemic. Just today, I had a member tell me that a customer came in with no mask, and they feel like they have to be the mask police, and they can't do that. They're dealing with getting sick themselves, even though they're vaccinated. The city should send a message and maybe have some type of task force out there to enforce the mask policy at some of these businesses and construction sites, because these people have to go to work every day and need to go to work to pay their bills, but they shouldn't be. They already have enough stress with going to work every day and under these conditions, but it's just they shouldn't have to be the police there in that business. Also, another thing that I hear quite a bit is paid sick time off for COVID protocol. They get told you have the symptoms of COVID, you need to go get tested, and they miss days of work, and some of them are just one paycheck away from, being homeless, and that's tough on them. A lot of single parents, and another also is hazard pay for essential workers is something that they've also asked for. So those are some of my my thoughts. Thank you for your time.
Thank you, Hector. Anybody else who submitted an idea that would want to add just a little bit more? So I think, Luis, we will go into. I think I see you have your hand up. Just want to make sure that we have. We're only opening this up right now to see if there's anybody else who has submitted an idea that has a comment. Otherwise, we're going to go open up the space for task force members to have questions or comments about the ideas under this category. And so I guess we'll go to you, Luis.
I just want to comment what our brother from UFCW mentioned. As an employer, along with the union, as long as we establish a policy to not allow no one to get into the premises without mask, I think that's all we have to do. We got the same problem with our laborers who go work in construction, and we establish some policy along with the associations who represent the employers, and that we're very successful on that.
Thank you, Luis. Christine, I see you have your hand up. Go ahead.
So yeah, pardon me. So yes, I just like to voice a concern or two and offer a suggestion. That is, first of all, in the case of no mask versus mask, yes, preferred to have masks on at all times, but we do need to recognize that there are folks that have health conditions that make it impossible for them to wear masks. Now, pardon me, I know we're living in uncertain times. However, perhaps the better choice here is to possibly address this individually as things happen. And to all of this, I'd like to offer my services as a task force member and as a staff member of Silicon Valley Independent Living Center as a resource to better understand what disability rights, which are civil rights, mean and how they work in all of these atmospheres. Because when we look at people, for example, that have gone through COVID infection, some of them have come out of it with lingering conditions that may stick around for a short time, may continue indefinitely. And this has to be the new normal, but we don't want to see people lose their positions because they cannot work. We need to take a look at how a person can work at their current position, if at all possible, given their new normals. Okay? Again, all of this circles around disability rights, which are civil rights, which as a person with a disability serving as a staff member of an organization that centers around disability and working with its task force, I'd like to offer my services to help everybody. And that's it.
Thank you, Christine. I I think you're the last one here with a comment. Otherwise, I will move on to the next. Did you raise your hand again, Christine? Oh, okay. So then we will move on to the next category that we've grouped some ideas under. For the category of supporting small businesses, we received 3 ideas that we grouped into this category, all on this slide. Number 10, the topic small business support was submitted by Jesus Flores of the Latino Business Foundation of Silicon Valley. And his topic is building from the Silicon Valley Recovery Roundtable report, quote, building a better normal, unquote. Number 1, increase small business access to capital. Number 2, improve digital capabilities for small businesses. And number 3, connect small business owners, particularly single mothers, to daycare providers. Idea number 11 was submitted by Ali Lopez of the Small Business Advisory Task Force. And her topic idea is small business recovery and beyond. The following areas are where small businesses continue to seek support. 1, access to capital. 2, lease negotiations and/or lease assistance. Number 3, staffing shortages. Number 4, pivoting. 5, and other issues such as support due to language barriers, ADA lawsuits, human resource support on new wage laws, sick leave and sexual harassment requirements, as well as recent legislative changes as of 2022 to ensure compliance. And then idea number 12 was submitted by Ivan Perez of Goodwill Silicon Valley, and another idea that he was submitted, and that was supporting small businesses. And this is educating businesses on various incentive programs that are provided by the California Department of Rehabilitation and the San Andreas Center, Regional Center, and other entities in hiring individuals with disabilities. So these were the ideas under the supporting small business category. Jesus, Ali, or Ivan, is there anything else you'd like to add or clarify on your ideas? If so, raise your hand and we can go ahead and call on you. Go ahead, Ivan.
So good evening, everyone. And it's actually Yvonne.
Apologies.
No need to apologize at all. It's just the name. So the one thing that I do want to add to this idea, it goes back to my previous idea about connecting particularly small businesses with agencies in the community, because I feel that there's a lot of resources already available to small businesses, but I think there is some lack of communication or knowledge of them. So instead of reinventing the wheel, I think it would be a good idea to create a bridge where we start connecting and communicating with small businesses and letting them know about different incentives, not only for individuals with disabilities, but also other, applicants who are experiencing barriers to employment. So how do we connect the dots, work together, and use what we have and build a foundation from there, again, instead of reinventing the wheel. So I just wanted to add that.
Thank you, Yvonne. Yes, I think connecting more people to these resources is important, and I think it also might kind of overlap with one of the ideas that one of the categories we have, which is community engagement, which we'll discuss in a little bit. And I think, having overlap between some of the categories is definitely going to happen. Jesus, I see your hand up. Go ahead.
Thank you, Carlos, and thank you, Yvonne, for those great comments and recommendations. I am more than a comment. I actually want to thank you all for this great group. Thank you, Rosalind, and for the great presentation last time as well. I think that probably I just wanted to add that there are different needs from the whole small business community. I always try to bring this issue that the federal definition for a small business is 500 employees or less, and or $10 million in income or less. And we know that, for example, here in the city of San Jose, we have over 65,000 small businesses. Out of those, 19,600 are very small businesses with 9 employees or less. And I believe that those need a special, I would say, a special committee. So when we are creating the idea of putting these committees together, I'm not sure if it might be necessary to have a specific committee for these very small businesses that, again, I believe need special attention. For example, 67% of our small businesses in East San Jose are women-owned. And out of those, 75% are single moms that are the only source of income for their households. So again, I believe that this group might need a specific committee to work on specific needs for them. And that was my comment. Again, thank you for this.
Thank you, Jesus. Yes, I think when you think of small businesses, you kind of think of those kinds, but I think this larger definition really is something that we should point out and make sure that we focus on when we talk about small businesses. I think that might be all the folks. So I think, so then I'm going to open it up right now to the rest of the task force to see if, open up the space for questions or comments from you all about these ideas or this category. Okay. Don't know if I see any other hands up. So thank you so much, Yvonne, Jesus, and Ali for these ideas. I think it's great for a great category. So I think let's go to the next slide, which leads us to the housing category, which we received 3 ideas that we grouped into this slide. Number 13 and number 14 were submitted by David Lowe of Destination Home, and number 15 was submitted by David Meyer of SV at Home. And so the topic number 13 was accelerating affordable housing production. Think through additional strategies to pursue or to accelerate our progress to build more affordable housing. And topic or idea number 14, sustaining rental assistance efforts. Envision what's needed or what efforts should be sustained, improved, changed to make sure folks who are still struggling remain safely housed as the recovery continues. And so I guess the 2 Davids, David, anything else to add to your submissions? Just go ahead and raise your hand and we can call on you. Go ahead, David. I'm sorry, you're muted. There you go.
Oh, thank you, Carlos. I'll speak because mine doesn't have a description. I think I was looking forward to seeing the descriptions of some of the other great ideas that people have brought forward so far. I think that when I look at what David Lowe has submitted, I think that what I was thinking about is very closely tied to number 13. And I think that organizations like Destination Home, Sacred Heart, and many other organizations in the community have been working to get emergency rental assistance out to people. And I think that as we are looking now towards, we've been talking about looking towards pandemic recovery for a long time, it feels like, but it does feel like that we have an important opportunity here to think about how do we integrate opportunities for actually taking on development of more deed-restricted affordable housing for people of all incomes, but especially for people with extremely low incomes, very low incomes, and low incomes. And so, I think like Rosalind mentioned earlier, this feels very tied to a lot of work the city's already doing. And so I think that for me, as I think about, what's the best way for task force and a solution committee or group to work on this. I think that it'll be great to talk more about how we can coordinate that with a lot of the great things that the city is already working on, and a lot of other organizations here and elsewhere are also working on. So thank you.
Thank you, David. All right, so unless David Lowe would like to add a little bit more, I'm going to go ahead and open it up to the rest of the task force. Should there be any other comments or questions or regarding this idea? And I see a couple people, and so let's go ahead and go with Christine.
So thank you for this. I think this is a fantastic opportunity to bring much needed low-income, severely low-income housing to the area since we're so impacted. And as we do this, of course, remembering that the governor has signed into law increases in numbers of accessible units, not only for those of us with physical disabilities, i.e. using wheelchairs, walkers, crutches, that kind of thing, but also those that use hearing aids and are deaf or blind and or visually impaired. But I'd also like to add one other element, and I'd like to see if we can add this in somehow as to the actual design process somewhere in there. In that, for example, where it is true that bathrooms have to be fully accessible, some designs of space are better than others. And the standard shotgun, if you will, bathroom development that isn't a typical unit will not work for those of us who are much larger and take up a lot more room. So I just like to put that out there.
Thank you, Christine. I see Dilsa Gonzalez of Somos Mayfair here. So go ahead, Dilsa.
Thank you very much. Good evening, everybody. I love the ideas about affordable housing production and the sustainable rental assistance, but I would like to also expand the idea of how can we start working on having a conversation where our communities are able to own their own houses and being able to buy their own houses. Unfortunately, renting and affordable housing, as we know, it's good. We know that that also can cause a lot of gentrification, our people to leave if we don't work on policies that ensure that they stay here, right? So how can we, as we start talking about our own workers that work here, that have their own businesses, about our kids and families that are in this area, how can we start talking about that? How can we start talking and bringing ideas of our own people being able to buy and own their own houses, to be able to sustainably be here for years to come, and for their generations to be able to also stay here in an affordable way, where they're not only paying rent every single month, and when they don't pay, have to, or another pandemic comes, they're scared to lose their house, to which their house are insured and they're able to stay. But once again, these ideas are really good. We do need to start taking care of our people, but I think that we could do a little bit more when we talk about owning houses, buying properties in our own communities, being able to stay here for the long run. Thank you and good evening.
Gracias, Dilsa. I think, Jesus, I see your hand up as well, también. Go ahead.
Gracias. Thank you, Dilsa, for that great comment. I wanted to also mention that we all know of the great necessity we have, the great need that we have for affordable housing and for housing in general. But I would also like us to be mindful of the impact that sometimes when decisions are not made, taking in consideration the impact. For example, we have seen that there have been several examples of new developments that are displacing small businesses, especially local family-owned businesses. So I think we need to be mindful of that. New housing is great, but we also have to be careful and have policies or support policies that also support small businesses from being displaced.
Thank you for pointing that out, Susan. Again, that kind of overlap in categories is a good one to discuss. Milan, I see. Go ahead. Go ahead.
Can you hear me?
Yes.
Okay. Thank you to the task force members that submitted great information. I think speaking from the Black community and several communities of color, one of the things that will need to be considered is communication as well as clarification, because on social media the other day, some young people in a particular age demographic released several public officials talking about things dealing with the pandemic when it first started, and they're using that as why they should not get involved with wearing masks, getting vaccinated. And I think the city can begin to send out messages that we were in a learning process in the very beginning of the pandemic, and how do we get even in our community, the Black community for that matter, more young people to share these messages, which kind of, I think, is connected to the item that you had regarding young people. But I think communication, public messaging needs to address authentically the concerns of communities of color that have an issue with the health system, and how do we get them on board to wearing masks and following all of these new mandates.
Thank you, Milan. I know that the City of San Jose, we had a social media influencer campaign for some of our vaccination efforts over the summer, and that was really successful. And that authentic voice, I think, is something that we should definitely continue. And thank you. That was Milan Valentin of the African American Community Service Agency. I just realized that one of our group agreements was that we would be mentioning our name and our title, just to kind of when we introduce ourselves for accessibility purposes. So got to make sure that I do that on my own as well too. So just point that out so we can continue that for the rest of the meeting. Derek Grasty of the Black Leadership Cabinet, go ahead.
Yes, thank you very much. I'm Derek Grasty from representing the Black Leadership Kitchen Cabinet. I certainly concur with what Mr. Milan Valentine had stated with regards to communities of color. Clear communication is always best, and using various means. A lot of young people use the social media aspect of communication, and so that needs to be tapped into as well. So given that regard, clear, specific information, they appreciate things that are short and concise with clear descriptions, and that messaging would certainly help our young people. Thank you.
Thank you, Derek. Again, I think that's something that we might kind of want to also incorporate into the community engagement category that we'll be discussing in a little bit as well. Milan, I'm going to put your hand down unless you had something else to add to your question.
No, 2 years later, and I'm still trying to remember how to take my hand down. Thank you.
All right. Anybody else with a question or comments on this housing category? Otherwise, we will move to the next category, which is one that I've kind of already discussed, the community engagement category. We received 3 ideas that we grouped into this category, again, all on this slide. Number 16 was submitted by Dr. Anu Balakrishnan of the Indian Health Center, and this is improving social determinants of health in the pandemic. Setting up a core group of people with areas of expertise in relations to housing, food banks, and employment services, and advertising these around the hardest COVID-hit communities of San Jose. Possibly setting up camps where people can use these resources to get a warm handoff or connections to a live person to utilize or learn about these resources. Another one was submitted by Yvonne of Goodwill of Silicon Valley. This is community engagement, which is educating families on various community resources. And number 18 was submitted by Kira Kazantzis of the Silicon Valley Council of Nonprofits. Another topic titled Community Engagement, Deep Community Engagement about what is needed for recovery. So I know that we've kind of there's been already some ideas around community engagement brought up by Derek and Milan, but I want to make sure I open it up to Dr. Balakrishnan, Yvonne or Kira to see if there's anything else you want to add to these 3 ideas that you submitted. If so, go ahead and raise your hand. Go ahead, Yvonne.
Again, so one of the things that I do want to add, not only educating them, but helping them understand the process of each service. Because, with the pandemic, has been a lot of turnover in staff for many community agencies. And let's say that, their social worker or whoever is supporting them, it's giving them information about an agency to contact. And when they reach out to that person is no longer there. So I think we need to be able to teach them how to have a call, what type of questions to ask. Or perhaps we need to have also agencies do a warm handoff to another resource in the community to better support them. Because I think, so there is many resources available to families, but sometimes the lack of knowledge or not knowing what to say or how to reach out to these agencies, it's a barrier. So I just wanted to add that. Thank you.
Thank you, Yvonne. I think I don't see any other hands up from either Dr. Anu or Kira, so I'm going to open it up again to see if there's any questions or comments or anything else to add from the task force regarding these ideas or the category. Nope.
I would like to make a comment. I couldn't find the little hand, so.
Okay, go ahead, Dolores.
All right, I'll do a clap because I can't find the other hand. This is a very interesting category here, and I think it's very good. And what I'd like to add is, part of community engagement comes from listening first to find out what people need, and then creating those relationships or strengthening those relationships that perhaps are already there. So it really, in my opinion, it comes from 2 sides. One is listening, creating, responding, and then the other is bombarding people with services, which is also very good. And I'm sorry that I used that word. I meant bringing resources. I think it's time that we start creating policy and programs that speaks to all the documents that we've all been signing for a month. We believe in social justice, we believe in racial justice, we believe in community power. So let's take this opportunity to really put our money where our mouth is, and instead of creating or suggesting ideas that tell the community what we think they need, maybe integrate along with resources an opportunity to listen and to create with them. And I like, I'm not going to put words in your mouth, Kira, but I think that's what yours is referring. Deep community engagement about what is needed for recovery. So thank you.
Thank you, Dolores. Listening, yes, very powerful and very necessary. And before I get to Dilza, I wanted to just, it looks like on the bottom of your Zoom screen, if you click on reactions, there's the little clap button, but then on the bottom of that, there's a little raised hand. So
I see it. Thank you.
Mimi is giving you the hands and the claps. There you go. So let's go with Dilza Gonzalez of Somos Maker.
Hi again, Dilsa Gonzalez from Somos. So as much as I agree with asking community what they need and what are the resources that we are missing, we also need to ask community and just keeping in mind, like, what have been some of the barriers that they have find when trying to reach for resources or anything, right? Because as a community member myself and as a community organizer, I have reached various community people saying, well, I call, I went, I email, and they haven't reached out to me. Or when I reach out to me, they told me that I need all this paperwork that I don't have. So when we're truly talking about community engagement, it's what are we asking and who are these resources for? Because if it is really for the community that are in high need, some of these community members don't have pay stubs, don't have documentations. Most of them are renters of one room, meaning that they don't have an address. So, so once again, right, like I agree, let's pull these resources out. But as we talking about resources, how we talking about how we ensure our family centers, our community centers are full equipped to give those resources to our families that are coming and knocking on their doors. Because if they're not fully equipped either, then as much as we pass the word out, our families are never gonna get fully served or equitable served when they're coming in. But yeah, like I said, I'm okay with this, but I'm also want to know, like, let's talk to our community, not only what are the barriers or what they need, because we kind of know what they need already, but it's kind of like when coming inside these resources or coming inside these organizations or community centers is what has been the barrier that doesn't allow you to get that resource or that is prohibiting our community to feel that they're not welcome. And being able to attack that and being able to say that without feeling shame, right? Because we are growing, we are in the middle of the pandemic. And as we go outside, we want to keep on growing and be able to serve that community that we are here representing today.
Thank you, Dilza. Mimi from Prosperity Lab, go ahead.
Happy New Year, Carlos. I kind of wanted to just on this community engagement, I just from my lens, since my organization works with small businesses and micro enterprises, I guess from our lens, when I'm talking about community engagement, I have 2 points on that. So I think for us, because we are already working with businesses daily, day in, day out, we're working with businesses. We're a direct service provider. So for us, we poll and our team is constantly looking to see what people are looking. So I think for us, we already have a pretty good idea of what the businesses that we serve need, number one. And number two, the community engagement, I think on this piece, I would only add that it probably needs to include business corridors and small businesses clusters. Because I know for us, we have been acting in getting information out, and I think the county and there's other organizations that may be present here that are already being proactive and have been providing outreach with education and resources to the community. But I would just, if these are some ideas that we're all hashing out, I would add that engagement with business communities is just as important because those are other families. And that most of us here, as Dilsa said, if you talk to Darcy or you talk to Milan, because we are in the front line all the time with the program participants, we already have a pretty good idea of what some of the things that we need and where the gaps are. So that's the only 2 things I would add.
Thank you, Mimi. Rosalie, I see your hand up. Go ahead.
Yeah, I'll be brief. I agree with what the folks have said prior about co-creation of what the outcomes should look like. I just kind of want to approach this from the community engagement from a higher ed standpoint. Right now we're in the process of creating a satellite campus in East San Jose, and we've been engaging with the community for the last several months. And from the educational standpoint, we've learned that it necessitates a component that illustrates what is possible. So instead of just like going into the community and saying like, well, what do you need? What is it? Tell us what you need, this kind of tabula rasa approach. We have to also have an educational component that shares with the community what are the kinds of resources that are available in a college or in a high school so that you're better informed about then you can tell us, like, what are the things that are important to you? What priorities would you have? Because most families don't know or know very little about dual enrollment, for example. And if their students enroll in dual enrollment, they could conceivably complete both their high school diploma and their 2-year degree at the same time, which is a huge savings in cost and time. But if folks don't know about that, we kind of go in and ask them for things that they don't know what they don't know, if that makes sense. So I just wanted to include that.
Thank you so much, Rosalie. Mimi, I think, did you still have another comment or was, okay. All right, unless there are any other comments, I'm going to move to the last 3 categories that we have. Data and budgeting. Both of these ideas were submitted by Kira of the Silicon Valley Council of Nonprofits. Equitable recovery budget. How budget process should be designed to ensure recovery and equity and recovery is addressed in the budget. Recovery success is predicated on people power and strategic fiscal positioning and resource development. And then data for recovery. Metrics and measurements about recovery, resilience, and equity in recovery, such as sourcing data and deciding on what data to prioritize. Kira, since you submitted both of these ideas, is there anything else that you wanted to add to this?
I feel like I should say something, but I don't think I think it kind of stands for itself. I have to admit, I don't recognize the second sentence in the recovery budget item. So someone else might have kindly written that for me. It seems fine, but I don't recognize that. So someone else might have proposed that. I guess, my thinking on budget is still, I know that the way that the ARP revenue, went down was that it probably means there isn't a lot kind of left for this group to kind of consider about deploying towards recovery. But, there is a larger budget. And so I think it makes sense for us to think about, is there a lens through which we need to look at, a recovery lens and an equity lens when we're heading into this budget season?
Thank you, Carrie. And I apologize about that second sentence. I think that might have been a bit narrow on my end. So sorry, apologies.
That's okay. That's okay. I'm like, well, that sounds clever, but I did not write it.
Okay. Are there any other members of the task force who want to comment or add to this category of data and budgeting? Or the ideas under the data and budgeting? Okay, we got 2 more categories, and I think both are on the next slide. We have the category of community health and wellness. We did get 1 submission, and that's from Dolores Alvarado of Community Health Partnership. And the idea is community wellness, which includes healthcare and healthy living. And then the category of arts and culture, well, I'm gonna stick with what we've been doing, just making sure that we stick with 1 category. So Dolores, is there anything that you want to add to this idea under community health and wellness?
I do. I'll just read what I sent to you, to your office. Community wellness can be applied to a community's ability to feel and be part of an engaged neighborhood, back to community engagement, have access to healthcare, feel safe, and be able to respond to emergencies, and to have a good communication plan. So I think it's all embedded into 1, but it would have been nice if you had just typed it up the way I sent it in. That would be most appreciated, because I think it may hopefully help foster some additional thinking.
Okay, hijoles, I'm sorry about that. I think I may have missed that email.
I like that, hijoles. You're from Chihuahua, I bet.
San Jose. Derek, go ahead. I guess I'll open it up now to any other comments under this category of community wellness. Go ahead, Derek.
Right, thank you. Derek Grasty, representing Black Leadership Kitchen Cabinet. With regard to community wellness, My only question would be, how would that be measured in terms of healthy living? What would be the data points, and how would those data points be used to improve the healthy living aspect or the healthcare aspect, as well as all the categories? Once you receive the data, how are you going to, how will the information be measured? What will the data be? What would be the data points? How will the data be used? And what action plan will be in place to, based on what the data says, to improve what's the activity that's going on? Thank you.
Thank you, Derek. Dilza, I do see you have your hand up. Go ahead.
Thank you. And thank you, Dolores, for reading how you put it on words. That's something beautiful and awesome for our community. I would also like to maybe add, when we talk about health and wellness, I also think about mental health for our families and our communities, right? How can we better serve them in a way that it's accessible for everyone, regardless of their status or about their health coverage? I know, unfortunately, a lot of our communities don't have access to health coverage. So when we're having these conversations, let's keep that in mind. Let's keep in mind how we serve everybody equally and equitable, and bring it to our mind when we talk about all of this. Is also, let's think about our more affected communities and being able to talk about trauma and what's going on, to be able to support them in the best knowledge that we can. And for me, mental health, social emotional support, it's a key for our families to be able to thrive as we're planning ahead. Thank you.
Dilza. And then Christine, I see you have your hand up. Go ahead.
So I would also like to add to that one more component that I know social services oversees in-home supportive services. However, it should also be recognized that many of the service providers, quote unquote, are family members. And we need to come up with a better way of, for example, recognizing this, supporting this financially as well, because they put in a lot of time and a lot of effort for their loved ones. When IHSS services may also be provided by folks not of the family, but of the community. And we also need to recognize that many of these service providers are people of color, and by definition are on the lower income spectrum. So again, helping the family and the service provider better make ends meet. Not only as we come out of the pandemic, but and beyond, if you will. Thank you.
Thank you, Christine. Dolores, I see you had your hand up one more time. Go ahead.
I did. I figured out how to raise the hand. You know, I want to thank the gentleman who brought up the issue of data and how do we measure success. And one piece I forgot to add to my sentence, which I will send you again, thank you, is to really focus on the health disparities, because that's really the way that we can, one way that we can measure if we're in fact moving the needle on disparities. And just, you know, disparities, as you all know, takes into account ethnicity and race and where you live, et cetera, so that we don't have to point out well, let me just stop there. But as far as measurement, you link health disparities to healthcare, you link health disparities to safety issues, you link health disparities to an ability to respond to an emergency, and that would make it a little more far more manageable for us as far as data. Thank you.
Thank you for that additional information, Dolores. Christina, unless you, I think you, I'm going to put your hand down unless you had something else, or I think it might be remaining from the last question when you spoke. Okay, so we'll move on to the last category that we have here, which is arts and culture. And this was submitted by Roy Hirabayashi of the School of Arts and Culture at the Mexican Heritage Plaza / Multicultural Artists Leadership Institute. And this is the topic of an idea of arts and culture. Highlight the need to support the arts in our many multicultural communities. Encourage businesses, corporations, and governments to use local arts and folk and traditional art forms in their marketing and messaging. Educate others about the diversity in San Jose. Use the Office of Cultural Affairs as a resource bank of artists and organizations to promote local artists and arts organizations, and then advocate that all San Jose city agencies use local talent first. And I think maybe just touching on this, and also maybe perhaps what Dolores provided, you know, that we did send out yesterday an email with an attachment of all the submissions, and it had the full submissions of everybody. I think just for space purposes, we did kind of condense some of these onto the PowerPoint slides, but you should find them in the email and also on the on our task force website. But I digress. Go ahead. I'm gonna open the floor here for Roy to see if there's anything else that you'd like to add regarding your submission under arts and culture.
Thank you, Carlos. This is Roy Hirabayashi. I'm with the Mali program at the School of Arts and Culture. I just basically, the statement is pretty clear, I feel, but it's really to get the city to use local talent and to really encourage also the businesses to look at how the arts community could help support the recovery, because for the artists, there are individual artists and small organizations, but there's a lot of wealth of information and services that can be helping everyone else. Writers, actors, musicians, composers, videographers, whatever it might be, in order to help promote and help market our community in different ways. And so I'd just like to make sure the artists are included in that process.
Thank you, Roy. Okay, and then I'll open it up right now to see if there's anybody else on the task force who wants to comment or ask a question regarding this idea. All right. Okay, so I think, thank you so much to everybody that submitted ideas. I think there are still some more ideas, and I'm going to go ahead and pass it on back to Rosalind on the remaining ones. We'll follow up on these.
Great, thanks so much, Carlos. So the next, I think about 9 ideas submitted. We wanted to hear from the task force proposer, just to make sure, number one, that we were clear, just probably needed to get more information. There could be an opportunity to combine the idea with another category once we have that discussion. So we can just, I guess, walk through them one by one. And Carlos, you're probably gonna have to help me call on people who submitted. So item number 23 is around creating and supporting childcare programs. So for childcare, we had one thought, because one of the city's recovery initiatives in the city roadmap that we presented last week, childcare is one of those initiatives. So we thought perhaps that might be an avenue to connect the task force to the work of the city and what we're already moving forward on. We thought that could be an idea, but really, I think, Carlos, we do want to hear from the proposer.
Great, and that's Yvonne, Silicon Valley. Go ahead, Yvonne,
Yes.
if you wanted to.
No, I just thank you for that information. I would just follow up on that.
Okay.
Thank you.
All right, sure. We'll be glad to follow up with you directly. Thanks so much, Yvonne. The next one is creating a mentoring model that helps students build agency and leadership skills at the middle school level. We know how important that is. During middle school, many parents actually disengage or reduce their support from school activities. And this is a challenge as this is a critical age of development for our children. So again, this was one that didn't necessarily fit neatly into one of the 7 categories that we came up with. Again, it does relate to the Child Care Recovery Initiative, and we can, Yvonne, work directly with you on that as well. But any other thoughts?
So the initial idea was to create a mentoring model at the grade level to help children develop that agency and at the same time develop those leadership skills and providing them with the life skills that they need to self-regulate and adapt to this unchanging world. And that would be the initial model. And the next model would be at the middle school level, which is emphasized on the slide. And that was, when I thought about that, the reasoning behind that was to help strengthen families in the community. Because if you think about it, where do families come together and engage the most? And that is at the grade level. That's when you are able to reach parents and you're able to have the entire family together. So that is one reasoning behind it. The second reasoning behind it is that sorry, I have my children in the background. I apologize. So the other reasoning behind that is that we're focusing a lot on adult population, and I feel that if we don't address some of these potential challenges at a younger when the population are at a young age, then we continue to have this bucket that continues to overflow, but we need to start also addressing our next generations and giving them the support and the guidance to build those life skills that are going to make the difference in the future. Because we could continue to support the adult population, which I believe we do have a lot of resources to do that, and now we just need to build that bridge. But if we don't address the future generations, then we continue to have this overflow. So I hope that what my comments make sense.
Definitely, absolutely. Thank you so much for sharing. And as you said, that's just a direct link to one of our pillars about supporting families. So totally get that. Christine, I see your hand up.
So I really love this idea, and I'm wondering if this is looking at a model such as city year, not city team, but city year, which is 18 to 24, if I remember correctly, as sort of a guide to creating such a thing, or maybe a junior league, if that's still around. And I'm wondering also if this is possibly looking at making this newer model, if you will, more of a nuclear family type process where the entire family gets involved, not just the student at grade level, but everybody comes together and supports the youth doing whatever the given project is.
Great, thank you so much, Christine. Ruben of MACLA, I see your hand up.
Yes, hi. I want to thank Yvonne for bringing this up. I completely agree with it, and I would like to offer my support in this section, I guess. I am the director of the youth space at Makla. I'm also an artist in the community. I have a collective called Emo Kids of Color. So I mean, for me, it's about, I guess, understanding what it takes to break the cycle, you know, coming from underserved areas. But a part of what we're able to do, what we've been doing through COVID with partnership with Aki actually, was to first establish the environment in our space. But what we've started to do recently is to go into the east side, go into other neighborhoods, and to help curb that the digital equity, you know, giving resources to technology that a lot of those neighborhoods, those youth in those neighborhoods don't have. So I would love to be able to help with this.
Great, thank you so much. So I'm hearing a theme around childcare and youth development, and it looks like we're going to get more comments. So I'll go to Dolores next.
I too, this is a very good one, number 24. And your initial question was, where would this fit in? And I'm putting words in your mouth, but you know, this one to me speaks of emotional health and mental health, because it does create self-assurance. So I see that going into health. I also see a piece of community engagement, because that's, as someone said, that's where parents gather. So they start forming relationships and neighborhoods and power together. So I like this because I think it goes across the board. So no matter where you put it, it's going to do well. That's my comment.
Thank you so much, Dolores. Dilsa?
Yes. So I want to say thank you for bringing this up. 23 and 24 are really important. As a community member and organizer, I could tell you that I could see perfectly where they fit, like Dolores said, community engagements, mental and wellness. But I also saw two propositions that were on there. One was that creation of different channels of opportunities for our youth. That we have middle school doesn't mean that they're not teenagers, right? Or that they can't get that extra support. So maybe we could, if the person that brought this forward could align it with this one, would be in a tremendous partnership and work that we could do. As a youth leader organizer, I hear a lot of my middle school saying, we need that role model, we need to do job shadowings, we want to grow, and we have aspirations to go to universities, but sometimes we don't know how to do that, right? And I believe it was perfectly said when we say we have a lot of support for our older youth, but for our more little ones, we don't. So how can we integrate these ones with some of the things that we have previously, as well as when we talk about creating and supporting childcare programs, we know that a lot of that disengagement happening in our schools is because parents cannot afford a childcare, cannot afford preschool. So how can we bring that as a wellness for our communities? If the kid is well taken care of, the mom or the dad or the family members can go and take care of themselves and take care of their house and mental health, and not to be worried where they live with their kids or how they're going to be taking care of their kids, right? Or have to choose between taking care of their kids or the next meal that they have to go because they can't go to work. But I do believe that it goes in a lot of the different areas that we have talked about. And I do agree with Dolores, there's plenty of space where we could put this proposition up there.
Great, thank you so much. Dolores, did you have your hand back up again?
No, I did not.
Okay.
Thank you.
That's fine. Just didn't want to miss you. I see Robin's hand.
Hi, thank you. My name is Robin Treen, and I'm from the San Jose Museum of Art. And I wanted to weigh in on this too. I think this is a really interesting and important idea for a couple of reasons. And I think it fits into arts and culture. I think it fits into community engagement. I think it fits into a lot, the mental health and the wellness categories. I think it fits into a lot of things. But I think it's also important as we envision what we want to do in terms of recovery, not to lose sight of sort of long-term future goals. And one of the reasons I thought about this is because in dealing with younger children, young kids, for a couple of projects that we're working on, I find over and over and over again that kids have a lot of concerns. They have a lot of concerns. We're handing them a world that is got some super serious problems, and they know it, and they feel it, and they feel the burden of it. And they also understand that it's a generational thing in a funny sort of a way. And they don't often get a chance to express that. I'm trying to think how to put this. They feel very, a lot of times tied to generational issues in their communities and traditions. And that can be sometimes a burden because, and I think parents and families sometimes are not all that good at supporting kids who want to do something a little bit different because it's scary. They might not be able to support themselves. And there are these very urgent, immediate needs. And yet kids are thinking about the future. They're thinking about climate change. They're thinking about really big term, scary issues. And they hear things, you know, on the news. I was talking to a 12-year-old a couple of weeks ago who told me that by the year 2050, I forget what he said, like 35% of the earth will be uninhabitable. Why does a 12-year-old know that? And this was hugely concerning to him. And I asked him if he had talked to his parents about it. He said, oh, no. He cannot talk to his parents about that. And I said, who do you talk to about that? Well, maybe his friends. I said, do you have any adult support where you can talk about these concerns or put forward your ideas where you to do something about this? No. And I think this is when children begin to form the idea of community outside of family. And I think it's really important for them to have that support, to find ways where they can find a pathway to make an impact, to address some of these things so that they're not just worrying about it. I mean, they're going to worry about it anyway. Everybody's worried about it, but to do something creative about it, to have some other form of expression other than just, you know, biting their nails and doing other bad things. So I think this is a really, really important thing. And I think it does. I agree with everybody who said it really cuts across categories. And I hope it can be expanded to really look at the way that the communities, you know, smaller communities and the larger community can work together to support the kids who are going to have to deal with these problems. And that is going to have to be part of our recovery as well. We have to also think about that future recovery. So anyway, that's my comment. Thank you.
Yeah, thank you so much. Really, really important comments there. Dolores, did you have your hand back up again? You're muted. Or
I do not have my hand up.
Okay,
I
great.
don't know. Yeah, sorry.
All right, no problem.
I'm
All right.
Yeah.
Thank you. All right, I'm going to move us right along because I'm very mindful of time. We only have about 24 minutes left, and we have still a few items to get through, and do want to have a little bit time for small group breakouts. So item 25 is submitted by Somos Mayfair regarding the Community Opportunity to Purchase Act. The focus on combating displacement, so our small businesses will not be displaced like our workers are, and ensuring stable mental health in this regard, as many of our workers and their families are stressed and worry about displacement. And so actually on this particular one, which is a really good idea, and it's something that actually the city is very much focused on, the City Council actually has approved a anti-displacement strategy. And one of the recommendations that's moving forward or being studied is around this community opportunity to purchase. And the housing department has this in their work plan. And actually they just presented at the Community and Economic Development Committee last fall, and we'll be going back to them and to City Council. So we thought perhaps that this particular idea is fully underway by the Housing Department, and we'd be happy to connect Somos, Mayfair, and others interested in this directly to the housing department. So, Carlos, anything else on this?
No, I think we're good.
Okay. And then item 26, the idea submitted by the Vietnamese American Roundtable states that committee focused on differentiating generations, age, racial, and ethnic equity that is supported by related community-based organizations and on both vaccination and testing rollout. And so I'm not sure if we have a representative here this evening to share more about this, but if we're thinking this idea is more about vaccination, boosters, testing, getting information to people, we thought that the clear opportunity would actually to be working with Alvin, who is the director of the vaccination task force with the city, that would be a really good avenue. So Carlos, anything else on this one? And I don't know if we have anyone here tonight.
No, I know Philip from the Vietnamese American Roundtable was unable to attend, and I don't see his alternate.
Oh, that's right. He did let us know he was not going to be able to attend this evening. Yeah. Okay. And we can follow up directly. All right. And then I think we have one more hand raised. I'm sorry, Dolores.
This time I did raise my hand. You know, you just reminded me that someone earlier talked about the lack of health coverage and where people go to healthcare. So I do want to just remind people, offer my services. We represent 10 community health centers. We also just worked with the county and Somos Mayfair, in fact, to create a local initiative that covers up to 400% FPL. So in truth, we're probably one of the only county that has such a variety of health coverage programs. My phone number is 408-556-6605 because no one should be without coverage at this point and without health care in this county. So thank you for giving me the time to do that.
Sure. No, thank you so much. Thank you for sharing that really, really important information. Okay, I think this last slide, items 27 through 31, were submitted by First Five Santa Clara County, and I believe Melanie is on the call. The one thing that we noticed with these 5 items that they're actually enterprise priorities in the city's roadmap. So these are areas where the city is already focused on, and we just wanted to provide the opportunity this evening. Melanie, or I don't know if anyone else is here from First Five, just to share a little bit more around the thinking of these proposals.
I don't see Melanie here on the call.
Oh, I thought I saw her earlier. Sorry.
Yeah.
Okay. All right. So for this one, we will follow up directly. But again, just wanted to note that these are areas actually that the city is focused on, and these are included in the city roadmap. All right. So next slide. Who am I handing this over to? So Aurelia is going to talk a little bit about some ideas that we had about structure for these committees, how they would work, and a meeting cadence. So I'll just turn it right over to you, Aurelia.
Great, thank you, Rosalind. Good evening, everyone. So my name is Aurelia Bailey, and I'm also part of the recovery team. Along with the committee topics that we just went over, a structure for these committees are also needed. So this is just the starting point. Again, these are just proposals to structure for committees. After this, we're actually gonna do a break into groups for you to share some of your thoughts on these. So the first one we have on here is your cadence, basically how often as a group should you meet, bi-weekly or monthly meetings, and how often should you report back to the task force meetings. Second is non-task force members or organizations can be invited to participate in committees. So think about Who else would you like to be part of the committee? They could be nonprofit agencies, business partners, or community leaders. Synergy collaboration between committees work. I think there was already some conversations that went back and forth tonight, like how can other committees support one another? For example, the arts committee, one of their goals is to support local artists within the community. So how can our workforce committee support some of their efforts? City staff, either myself or Carlos or Katarina will most likely be sitting in one of these committees. And then also one of our consultants that we're currently working on to get on board to help us with this process, and there'll be another added resource. Lastly is to provide an input in developing task force report to City Council, whether it's a new idea, some tactical solutions, or some policy recommendations. So with that, I'm actually going to stop there. I think, Luis, you have your hand raised.
Yes, thank you. I also had a question about the process and next steps. So there are 31 committees proposed, a lot of good ideas, but I think it's obvious we can't create 31 committees. So what is our process going forward? How are we going to narrow it down?
Great question, Louise. And that's exactly where I was going to segue into now before we ask you all to go into breakout groups, because you're right. I mean, first, just let me say the ideas, thank you. They are tremendous. It just really demonstrates all of your commitment. All of you are doing amazing work already in our community. So first, just thank you for submitting these ideas. I think many of them are building from ongoing work, and I think that's great. We have opportunity to leverage a lot of things that are already happening. But Louise, to your point, 30 plus committees becomes a little bit difficult to manage. And that was one of our reasons for grouping them into categories. And so what we're going to ask you to do as part of the breakout exercise is to talk about how we might get to a more manageable number of committees. We know forming committees and participating, your time, it's a lot. And we know that many of you are already stretched. So we want to have a really good conversation about that. So we're hoping that during the breakout exercise that you'll come up with additional ideas to further group ideas and put them in a category. For example, the small business, or maybe it was the supporting the workers category. I think we had like 7, 8, or 9 different ideas. There could be opportunity to group those ideas together, maybe come up with 1 or 2 committees. But that's the thinking. And so that is what we would like for you to talk about in the breakout groups. And perhaps if you could go to the next slide as well. We also, this work requires you guys to volunteer. So we want to hear, we're going to be asking the facilitators to actually note who is interested in what category or what idea, because this is, you all working, we're assisting and we're supporting. City staff will be here alongside you, but it's going to take all of us working together. And then to talk about, who else needs to be part of these conversations, right? And we talked about that, I think, at the very first task force meeting, that we're very grateful for the 55 of you all, but we know that there's so many experts in our community. And when I say experts, our residents, they're our experts, right? Our small business owners, they're our experts. Our teachers, they're our experts. So, we have now the opportunity to tap into so many other individuals to help us in this work on the committees. And then any other ideas you have about the structure, particularly the meeting cadence, is going to be important. So with that, I'm going to ask the team, did I miss anything? And we'll also take any questions before we do assign you to the breakout group. Carlos and Aurelia?
No, just I think this slide I believe says 10 minutes, but we're gonna try to. I know that we're getting close to past the 8 o'clock hour, but we're hoping that we can. This is an important discussion that I'm hoping that we can have. So we're gonna try to have this group to meet for 15 minutes. So we're gonna break you into five groups of about 10 to 11 people each. Members of the public, you will be placed in one of the breakout groups as well, and you will have the opportunity to leave the group and you've been placed in and join another if you wish. Just be careful. There is on the bot. You'll have the opportunity to do that will be available on one of the tools on the bottom of the Zoom screen. Task force members, we do ask that you stay in the breakout room you've been assigned. You're just randomly placed, but having you in one of the rooms ensures that we have a balanced distribution of task force members in each group. And so, as I mentioned, we're gonna try to meet for have a 15-minute breakout group session and then about a 10-minute report back. So if you want to select someone on your group to kind of take the key takeaways and then report back briefly after the breakout discussion. I believe that's it. I did also want to mention if there are there's anybody in the here in the group that needs Spanish or Vietnamese interpretation. If so, raise your hand and we'll place you in the appropriate room right now. Okay, I don't think I see anybody else with their hand up, so I think we're just going to go ahead and distribute everyone through your into the groups. One other question. I know we've had okay, Araceli. Yeah. We're gonna go ahead and place you into the room with the Spanish interpreter. And Jose Rodriguez, are you also requesting Spanish interpretation? Okay, we'll place you in the Spanish one as well too. So one other question. I know we're getting close to 8 o'clock, but we just had a long discussion. We're about to have you go into a breakout group. Is there a desire within the group, the team here, to have a 5-minute break to grab some water, go to the restroom, or grab a quick snack? Otherwise, we can go directly into the breakout groups. But I just wanted to get a sense of where everybody's at. That's a good question. I think so. We're in the report back period, so if we have 5 groups, and I hope there was at least one person who had volunteered or self-selected. And so I guess I'll start with the group that I was in. So Luis, did you want? Thank you for volunteering. Did you want to maybe be the first one to report back, and then we'll have someone else identify. And also, big shout out to Armando, our interpreter for that room. He's the all-star.
Yes, thank you. So I should say that not everyone in our room got a chance to speak. The time was pretty short. A common theme among those who did was that we were interested in many of these committees, but would only be able to commit to 1 or 2 and really need some time to digest and decide which one or ones we would want to join. So it was proposed that there could be a poll of task force members asking, which committee would you be willing to commit to, maybe pick from 1 to 3, and that could help initially narrow down the committees. There was also, I think, a feeling to let the committees choose how many times, how frequently, and how long they would need to continue meeting, that not all of them necessarily need to keep going until November. There was a suggestion maybe bi-weekly meetings for the first 2 or 3 until we figure that out among themselves. There was interest in the Small Business Support Committee and inviting business owners to join that committee, and a suggestion to be able to upload videos, I believe, of this task force meeting and the committees, so that community members can see them even if they can't attend at that time. And anything I missed, please speak up.
I think you captured it well. Well, I mean, I'll let other folks in our group comment, but I did want to say that these meetings are being recorded and they are available on YouTube. They will be available on YouTube this meeting will be available on YouTube by the end of next week. So well, I didn't have a chance to respond to Dilsa's comment, but I'll leave it at that.
Carlos, our group will go next. I'll call on Dolores.
Okay, thank you. Our group did not have a lot of time to talk about this particular, we talked about other things, but I think the overarching and common theme was that one way to approach this could possibly be coming in with the lens that we bring, from our own perspectives and our own professions and our own job into almost every committee. So for example, community engagement crosses across the board. There's a lens on that one. Hospitality, we identified that healthcare and health is a big issue in the hospitality labor issues and workforce issue. Workforce was huge from a health perspective, a surge perspective, as well as a, what was the other one? Labor issue. So I think that's as far as we got, and I think we enjoyed the complexity of the discussion because I thought we went pretty deep very fast, and then we were cut off. We were shut off. I hope that captured Aurelia.
Yes, thank you. Rob, do you want to go next?
Sure. And Christine is our report back person. Christine, let me know if you want me to share any information with you.
Okay. So I'll do my best, and if I go astray, please, give me a nudge. So what we did was, with the time we had, we took a look and admitted that the 7 key components were a pretty good mixture. We also looked at adding more by way of youth throughout, but definitely a youth component that looked to improving the student activity and such, and the education component, again looking at the breadth and width. Oh boy, English. Oh man. Looking at the current standing of both higher education and K through 12. And did I miss anything?
Let me add a couple things from the groups. Community engagement and access was a suggestion. There should be representation of youth in envisioning the future. And with the community health and wellness, social and emotional wellness as well. But as Christine said, there's a strong voice for more youth and education in these 7 groups. And then who else should join us? The disability accessibility voices on every committee would be informative. Education stakeholders, the College of Adaptive Arts sounded like a great partner to bring in. Leaders from the hardest hit neighborhoods to make sure that what we come up with resonate where it needs to have the most traction. The organization Luna was advocated for, as well as Californians for Justice as great partners. And then also if we can bring in youth leaders and find a way to incorporate them into each of the committees. Christine, did I miss anything?
No, I think between the 2 of us, we knocked it out of the park.
And we will need a poll for people to join because I only got 3 of them. So.
Thank you, Rob. Thank you, Christine. Let's go ahead with Mike's team. Did you want to check in, Mike, with who elected to report out?
Sure, we have Derek is going to represent us on Team 5.
Hi all, Derek Grassi again, Black Leadership Kitchen Cabinet. We discussed combining the committees and seeing how some could fold into others. Also, what would be a good minimum for committees, and we sort of came to the agreement that 5 would be a minimum for each committee, and how many hours could a member devote per month to be on the committees, and whether it be better daytime, evening. That was passed around, and final thought was the synergy between the committees, that be working well, and that people stay informed. Also, topics can still be submitted to the task force, and that was received well. And so the consensus was to pare down the committees and a maximum of 2 members per two members per committee. Excuse me, 2 committees per member. How about that?
All right.
And that's it. Thank you.
Thank you, Derek.
Thank you, Derek. Thank you, Mike. And I think Rosalind, your group is the last one.
Yeah, so we got pushed back into the main room just when I was about to get a volunteer. So my group is amazing, and I know someone's going to volunteer to share a couple of key takeaways. And I'm not going to have to ask someone to do it because I'm not going to do it. Okay, I will ask.
I'm happy to do it.
Thank you, David. Thank you, David.
Rosalind knew if there was enough silence, I would say something. But I think the main takeaway for us was just kind of think about how do we manage all these great ideas. And so a couple of us thought maybe the best way to go was to stick with the 7 categories that these ideas were grouped in, have committees formed around that, and have the people who are kind of volunteering because of subject expertise or interest kind of go through those ideas and kind of be able to either narrow it down or focus all of them and kind of develop the recommendations from there. So I think that's mostly what we talked about. Talked a little bit about cadence. People generally thought monthly meetings were good to kind of get that right balance of enough people's time to get through them, but also, the month after month work needed to get through these issues.
And I got to give a shout out to David and his scrum board in the back. I see his stickies.
It's not a scrum board, but thank you, Rob. I knew someone from my old city days wouldn't appreciate that.
Hey, I don't know if there's anybody in your group, Rosalind, that would want to add more to what David reported. Otherwise, I think we're good.
It sounds like we're good unless anybody else wants to add anything. Okay.
Oh, hi. I wanted to add
Yvonne. Yvonne?
Sorry.
No, it's okay. Go ahead, Ashley. Go first.
Oh, okay. Thanks. I was just this is my first meeting, so I'm still kind of taking everything in, and I need to, and I'm with First 5, and I need to confer with Melanie kind of what our strategy is, so I can be a little bit more supportive during this meeting, but thank you for having me. One question that came up just as I was listening, and I think Derek brought this up, and so did Yvonne in a way, talking about data and sort of looking at like, what are we doing that is working and what's not working, and where are the gaps in terms of accessing things, and really looking at that data and really making that the priority in terms of the budget, and really making sure that we have the adequate tools and resources and staff to really look at that data on a very deep sort of granular level to figure out what is going on, because a lot of these needs that like the community and small businesses have aren't new. They've just become more compounded due to COVID, but the needs have always been there. And so I'm just wondering if there's a discrepancy between what the city thinks that they're meeting in terms of the community's needs and what needs are actually getting met, and how we can look at that and be more intentional around tracking the data for future fiscal years when we talk about budgeting.
Mm-hmm. Thanks so much, Ashley. And we'll be sure to connect with you and Melanie on the ideas submitted. Thank you. Yvonne?
Yes, I'll be brief. So my comment was going to be around the comment that I believe Annie mentioned in regards to what is the end result. I think that it would be very helpful for the communities to have a clear picture of what is the outcome and what is the timeline to accomplish that outcome. It would give us a lot of direction in how we move forward. So just wanted to add that. Thank you.
Thank you. That's an excellent point. We did talk about that in our group. Carlos, did we get to each group?
I believe so. I think we are ready for the next, unless there's anything else, we're going to get ready for the next, the second to last item of our agenda, which I believe is public comment. And so this is an opportunity for members of the public who are here to have 2 minutes to make some public comment. So if you do want to have a comment, just raise your hand and we will call on you. You will have 2 minutes to share if you wish. B. Beekman, go ahead.
Blair.
Hi, thank you. Blair Beekman here. Hi to everyone tonight. Thanks a lot for this meeting and this process. I'm hopeful for it, what it can work towards. I hope you're taking good advice and hearing good advice from previous charter commissions, the Reimagine Task Force. There's a lot of commission processes that have been going around the past year in San Jose, and hopefully there's a equity roundtable that can be coming up as well. So just hearing good advice and collecting good advice, good practices at this time. Good luck in these efforts. Good luck in preparing for 2023, whatever that may be. I'm not sure if that is a year of natural disaster preparedness we should be concerned with, or is it a year that we really bring together the ideas of reimagine, racial equity, health and human services? I'm not sure. Either way, let's hope for good preparedness practices in 2023, and an important part and purpose of this commission this year. To conclude, I just wanted to quickly offer that if you've noticed, there's a lot of new law enforcement practices going around in San Jose and Oakland, San Francisco, Berkeley, and all Bay Area cities, to deal with smash and grab issues, looting. It came on so strong and suddenly that I think we're a bit overwhelmed, and I think we're actually going to be relying on the practices of Reimagine and Health and Human Services, open public policies, and accountability that can really help these law enforcement questions at this time. And I just wanted to remind everyone of our better ideals and better practices that can define law enforcement things at this time, and good luck how this process can grow. And it can be a full community process, invite all voices to this.
Is there anyone else that would like to make a comment? Please raise their hand now. It looks like that's it for public comment.
Thank you so much, Katarina. Appreciate it. Go ahead, Carlos. Okay, so we'll just go right into next steps. So again, just thank you so much this evening for all of your time, all of the ideas, really, really good discussion. It's going to be a lot of good work, I know, going forward in the weeks and months ahead. So thank you. Our next meeting is scheduled for Thursday, February 10th, 6 o'clock. Of course, it will be virtual. You've got information here on our website, our email, if you need to reach any of the team members. And we will be in communication with you after we kind of do a debrief and think about how we might want to move forward with the committee ideas. I think definitely the idea around polling will be one that we will move forward with, but you will certainly be hearing from us very shortly. And so with that, if there's anything else I need to say, team, Any last comments, questions?
No, thank you so much, everybody, for this awesome, just so many great ideas. And as Rosalind mentioned, just, yeah, lots for us to debrief, and we'll be communicating back with you.
Thank you and good night, everyone.